Well, September is Prostate Cancer Awareness Month. The CDC says prostate cancer is the second most common cancer among men in the U.S. behind skin cancer. It's also one of the leading causes of cancer death among men. We've reached out to Dr. David Moore, a urologist with Deaconess Hospital, to help us understand what we need to know about prostate cancer. Dr. Moore, thank you for joining us. What are some of the symptoms that men should be looking for when it comes to prostate cancer?
Thanks for having me on, Shelley. Generally, prostate cancer is actually asymptomatic, so most men that present with prostate cancer were found because of a result of screening. Before the screening era, men would present with obstructive urinary symptoms, so not being able to pee, or even metastatic disease, where they'd have prostate cancer that had spread to their bones and was generally not treatable. But nowadays, generally, prostate cancer has no symptoms, and it's picked up purely just with prostate cancer screening.
So that, I'm sure, creates an obstacle for you all in getting it early, because I know any kind of cancer, early treatment is vital to survival. Is this the same in prostate cancer as well?
Yeah, it is, absolutely. Certainly there's been a great deal of controversy with PSA screening. PSA is the blood test that screens for prostate cancer, and when it was introduced, it led to about a 50% reduction in prostate cancer mortality. So a lot of men's lives were being saved. But the corollary to that was that a lot of men were receiving over-treatment for their prostate cancer when it may never have impacted their lives. And so today, our approach to prostate cancer screening is that we like to choose the right men to screen, those that would benefit from prostate cancer treatment if it were found.
And so who are the right men to screen?
So the American Urologic Association recommendations are for ages 55 to 69, men that those types of men would be appropriate for PSA screening, but we don't universally recommend that everybody be screened, because there certainly are risks associated with screening, like needing a prostate biopsy or over-treatment. So it's those men that should sit down with their doctor and talk about the risks and benefits of screening and see if those screening tools are right for them. Now, certain men, like African-American men or men with a family history of prostate cancer, would certainly benefit from screening either earlier in their lives or even later in their lives as well, and so they should talk to their doctor sooner.
And you were saying that's so important, because we don't really know what, or do we know what causes prostate cancer? So that if it is in your family, it's important that you don't wait. You need to go ahead and start screening early.
Exactly. Yeah, we don't have a great understanding of what causes prostate cancer. Certainly a lot of research is being done and needs to be done in the future. Maybe someday we will identify a specific gene or a virus that's associated with prostate cancer, but to date we just know patterns, and certainly those men that have prostate cancer in their brothers or in their fathers or anyone else in their family, or if they have history of certain mutations like the BRCA mutation and have a lot of history of breast and ovarian cancer in their family, we know that those men are also at higher risk for having prostate cancer.
So do I understand you correctly in saying that that if a man has a mom or a sister with the BRCA gene, which is a breast cancer gene, they may be more likely to have prostate cancer?
Yes, they may. Yes, they may. There are certain types of mutations that are also associated with prostate cancer, and so those men may also benefit from prostate cancer screening earlier or later in their lives, and need to have that discussion with their doctor.
So I think that's really the theme here, is that no matter what your age is, you should have the discussion with your doctor. Then the two of you can decide if you need to have the screening right now or if you need to wait for it. But it's one thing that you must have that discussion.
Yeah, it's imperative that you have that discussion and be offered screening if it's right for you. And certainly if you're found to have an elevated PSA, historically we would have gone straight to a prostate biopsy, but nowadays we have a lot of other tools in our armamentarium to additionally risk stratify men for prostate cancer. There's additional blood testing or even imaging testing with MRIs and other things that we can do to better identify those men, even with an elevated PSA, who would benefit from a prostate biopsy, which is the diagnostic tool for identifying prostate cancer.
All right, Dr. David Moore, unfortunately we've kind of come out of time here, but you've gotten into something right there that's very interesting, the fact that it's very different now treating this type of cancer than it was, say, even 10 years ago. So Doctor, thank you so much for taking the time to talk with us.
Exactly.
We hope to talk to you again soon. Thank you so much.